we can record. Great, thank you, Ian. So my name is Cassie Westmoreland. Ian Fletcher is also going to be on the line helping us out with the webinar today. And we are, of course, here to talk about the ESG CV1, which is the Emergency Solutions Grant funding that came down through the CARES Act. We also have, I believe, our HUD TA on the phone to answer any of those fun technical questions that you guys might have. So please feel free to use the chat function as we're going through. There's going to be a lot of information coming at you really quickly, but we do have an hour and a half today, so I'm hoping to get into any questions or concerns you guys have and be able to answer those and talk through those. So please do feel free to use the chat function as we go along. Ian just sent a message. Thank you, Ian. And yes, this webinar will be recorded. It will be posted on the DOH website and hopefully a resource for you guys to use as we move forward with ESG. Okay, so next slide. Okay, so this is just a quick agenda of what we're going to talk about today. So most of the folks who are getting the CV1, which is the first allocation that's coming to our ESG program through the CARES Act, are previous ESG recipients. So we're really going to look at what we know is different between ESG and the CARES Act funding. We're going to give you an update about timing and expected contract dates. We're going to talk about COVID and how it has to be connected to COVID and what that means and what we know about that. We're going to talk about a few of the differences in the programming that we know of right now, specifically around homelessness prevention and coordinated entry and some of those sorts of things. We're going to talk about data collection and reporting changes, and then we're going to have, like I said, some time for questions and contact information at the end. Awesome. Okay, so next slide, Ian. Okay, so we just wanted to start with kind of a really high-level overview of what we're looking at. If you guys have been on our external engagement meetings, you've seen this chart before, but this is all of the money, that second column there that says traditional ESG, that's what the entire state of Colorado generally gets for ESG every year. So you're looking at about $3.2 million. Between the CARES Act, we're looking at closer to $55 million between the first and second allocation. So this is a huge amount of money. It is intended to be used over the next 2 years, but still more than 10 times what we usually get. So we're really looking to leverage these dollars and make sure that we have a better system in place. Obviously, our first priority is to respond to this pandemic and make sure that folks who are experiencing or at risk of homelessness are safe and secure and have the resources and services that they need. But our second priority is to really strategically invest these funds so that when this pandemic is over, we still have a better homelessness response system than when it first started. So we are working with the City and County of Denver, the City of Aurora, and the City of Colorado Springs, which are the other 3 entitlement communities in the state, to make sure that we are leveraging as opposed to duplicating these funds. So just wanted to give you guys that big picture. So as far as our allocation for CV1, Ian, if you wouldn't mind going to the next slide. So this is what that looks like by category. So you can see the amounts there of how much we've invested in each activity or ESG component. And we also separated it out by the continuums of care. That's part of how we decided this first allocation is actually looking at HMIS, point in time, hit count data, all of that sort of stuff, and proportionally allocating the resources based on the need that way. So this first allocation is really intended to be quick emergency response, getting the services and the resources that are very desperately needed into the hands of the folks who are doing the work, which is you all, so thank you in advance. And so yeah, we just wanted to give you that overview. Our ESG CV2 is much larger. It's $25 million as opposed to about $7 million, which is what we had for the first allocation. And so we're really spending some intentional time thinking about how to invest that second amount of funding a little more strategically. And we'll get to that at the end. Next slide. And here's just a quick list of everybody who has received the ESG CV1 funding. So a lot of these folks will look familiar. A lot of them there are a few new ones there. But we did have 34 awards that were made through the needs assessment that you all did. Okay, Beth, no worries that you're late. It is we are just getting started, so no worries at all. All right. Go ahead to the next slide. Perfect. All right, so here's where we really get into the meat of ESG versus ESG CV, and that CV is the CARES Act. So the first and most important thing that we want to say is, as more of a caveat really than anything else, is that we still have not gotten the official guides from HUD on what these dollars can and should be used for. We know through the CARES Act what the intention of the funds is. We know what normal ESG can be used for. We've gotten guidance on a few specific components of it, but please take everything that we say with a grain of salt, because when the guidelines do come out, it could change. It could be exactly the same. You know, we're not really sure. We are hearing and getting great advice from our HUD TA, and they're really helping us navigate this. But we're all kind of waiting on these guides to come out, and when that does come out, that's what we will have to go with. So you'll see in the contracts that you all will get that there's some language in there. It's pretty vague. It basically just says, you know, make sure that you also look at the guides, because whatever is in this contract is actually also contingent upon these guides that we don't yet have. So make sure that I'm just trying to caveat that. I want you guys to all know that. But what we do know about the CARES Act funding is that it's intended as a resource to really prevent, prepare for, and respond to the spread of COVID-19. So it's a new resource. It's all of the entitlement communities and states got this funding, and it came through with other funding such as CDBG, Community Development Block Grant, HOPWA, which is Housing for Persons with AIDS, SSDF, the Veterans Program, and a lot of other emergency funding sources. We also know that there are a few differences in the CV funding from the regular ESG funding. So for example, coordinated entry is required for both homelessness and homelessness prevention activities. So usually prevention was not something that coordinated entry was required for. All of ESG is required to work with coordinated entry and be involved in coordinated entry systems, but this program is really explicit about prevention being done through coordinated entry. We'll dig into that a little bit later. There is no match required for the CV funding, which hopefully will be a sigh of relief for a lot of you. So we're not asking for a match with these funds. Again, it does have to be connected to COVID. Another thing that we know about prevention, not rapid rehousing, but prevention, is that it actually increases the AMI, or the area median income limit, from 30% to 50%. So we're looking at a little bit of a wider population of folks that we can serve with the prevention dollars through the ESG CV. There are some HMIS and data collection changes. Most of that burden will not fall on you all as much as it will your HMIS leads, but again, we will get into that later in the presentation. And costs can be covered starting from at least March 27th of 2020. That's what's in the CARES Act. We might get a different date in the guide, but we can at least go back through March 27th. And again, it's all about what you were doing in response to COVID at that time. The other thing that we do know is that funds have to be drawn by September 30th of 2022. So we're looking at just 2 years and a month at this point. So really, really quickly trying to get this first round out so that we can move forward with the second round as well. I don't see any questions so far, so let's go ahead and go to the next slide. Okay, so just a couple of updates around timing and what we're expecting. So for the CV1 contracts, which is the first allocation, we are finalizing those contracts now and getting them to our contracting team for them to start routing. But again, costs will be eligible to be reimbursed from March 27th, 2020 through March 31st of 2021. So usually that pre-agreement sort of cost is not something that we can do in ESG, but because the CARES Act is so specific about being able to cover costs from that date, we are including that in our contracts this year. So that will be a difference from folks who are used to getting ESG funding. And again, it has to be costs that were related to your COVID response within the activities for which you're funded. Going through March 31st of 2021, so that's the same time frame more or less that your regular ESG contracts will go. The intention is then to have the CV2 contract out the door, implemented in communities, so that there won't be a break there between, the increased funding that folks at the community level are seeing. So that's the timeline for the first contract. For the second contract, for the CV2, we are hoping that a NOFA will come out in early September. NOFA standing for Notice of Funding Availability, which is just our fancy word for our application process. And we really are hoping to see a quick turnaround on that because of that September 30th, 2022 deadline. We have no flexibility around that. So the quicker we can get the CV2 funds out, the longer you all will have to run these programs and get money out the door. One of the things that we are looking to do is potentially include the regular ESG NOFA in with the CV2 NOFA, so as to reduce the number of applications that you all as grantees have to do. So let us know if you think that's a good idea. We definitely want to ease the burden on you all as much as possible, but still have to go through some of these processes. And it looks like I'm seeing some questions, so I'm just going to go through those really quickly. Nan, yes, so the prevention dollars for CV1 are through the COCs, the Continuum of Care, and they each will have their own sort of sub-granting process, but we are working with the COCs to make sure that folks who ask for prevention or rapid rehousing through our needs assessment will have access to those. I think I owe you an email, Nan, on that one, so I will get that to you today. I've been out for a few days, so apologies for the delay there. Shauna, are there different deadlines depending on the entitlement community? So deadlines, in terms of the application process, yes, there will be different timings for applications and those sorts of things. But in terms of having the money spent down, no, all of the funding has to be spent by September 30th of 2022. And then NOFA stands for Notice of Funding Availability, and Beth says a simplified application or renew to expand existing contracts would be preferred. Great, that sounds awesome. Okay, perfect. And then, yeah, guys, if you would just make sure you're sending your questions to all panelists and attendees, then other folks can see the questions too. Okay, Melanie asked, from a record-keeping standpoint, combining the two ESG processes might be a challenge, especially if normal ESG has a match requirement. Yes, Melanie, that is a really good point. And those are some of the questions that we're trying to work out now. So just keep that, combining the NOFAs or having separate NOFAs as a nugget in your mind for when we get to that question and answer section, because we want to hear all of that input. Okay. I don't see any other questions. If I missed one, I apologize. Just let me know, Ian, if you see another one that I missed. But the other thing that we did want to let you guys know about is our CV2, our last external stakeholder engagement meeting will be on August 31st. So not this Monday, but next Monday from 2 until 3 p.m. And that's really an opportunity for us to get out and hear from folks where our priorities should be, what sorts of activities we should be funding, what's the need, do you have prevention in your community so we can focus on other funding activities, or do you really need, prevention, or we need shelter, we need non-congregate shelter, we need, what is it that you guys need? So we can send out that link. Ian just put it in the chat, actually, so thank you, Ian. But do feel free to attend that if you are interested at all in the CV2 process or have any questions about that. Okay. Thank you guys for those questions. Keep them coming. Ian, if you wouldn't mind going to the next slide. Perfect. So again, we do know that these funds have to be related to your intention to prevent, prepare for, and respond to the COVID-19 pandemic. We don't 100% know what that's going to look like realistically, right? We don't know what that means for documentation processes, what sorts of documentation we'll need to collect. We don't know exactly if there are going to be specific activities that can or cannot be covered in the guide. But this language here that's in italics is what actually comes from the CARES Act itself. So really trying to be cognizant of focusing these funds in the areas with the highest needs, with the populations who are most at risk, which of course is all of the folks that we are serving. So one of the things that we do want to make sure that you all are thinking about is that if you have been spending funds since March 27th of 2020 on COVID activities, could we use your CV1 allocation to reimburse those funds and then you guys could have free up funding for other activities that might be needed outside of your response to COVID. We're really working closely with HMIS leads to try and figure out how this works and where to track it in the system and what all of that means just for documentation purposes and reporting purposes and fidelity purposes. But do know and be thinking about how to show the connection between what you're doing with your ESG CV1 dollars and preventing, preparing for, or responding to coronavirus. Yeah, we're going to keep hammering that one because that one's really important. So if you have any specific questions about activities, feel free to reach out to us and let us know. I mean, I think everybody on this call understands that helping folks who are literally homeless, and it is in and of itself preventing, preparing for, and responding to coronavirus, but we do have to make sure that we are tracking that appropriately. And again, working with the HMIS leads to figure out the most simple way for you all to be doing that, and if there's a way that we could just kind of do it across the board to make it easier. Okay, so Julia, is there a possibility that funds could be used for capital expenses COVID related? So yes and no. Yes, we can have renovation as ESG funds. That is an activity that is allowed under the regular ESG regulations. Usually we haven't funded renovations with our regular ESG because we literally only have $2 million a year. So it is a possibility, but it's something that we are trying to route to other sources of development funding. The other trick with that is that any renovation that's done on a shelter, for example, would have to be a building that's owned by a government entity or the nonprofit that's running the shelter. We can't do any renovation, at least in the regular regulations, we can't do any renovations on buildings that are not owned by a government entity or nonprofit shelter. There might be flexibility in the guides that do come out, but again, right now we're just using the regular guides as our operations. So, Julia, if there are specific questions like that, feel free to reach out and let us know what you're thinking. We've been connecting people to our development teams, but they're also stretched for cash right now because of the state's budget shortfalls. So we'll help you to figure that out as much as we can, is the answer that I could say right now. Okay, but just one more thing to your point, Julia, about COVID-related capital expenses. That would be an eligible activity because it does have that COVID connection. So just want to throw that out there. Okay, next slide, Ian. Awesome. So really diving into the homelessness prevention stuff. So this is one of the few areas in the CARES Act regulation that actually has some program specifics that we just want to make sure that you all know about. Most of the folks on the phone are shelter or outreach providers, but again, the continuums of care do have prevention and rapid rehousing funding that they will also be granting out. That came from our ESG CV1 allocation. So if you do have prevention money that's coming through the CARES Act for ESG, do know that area immediate income for prevention, not for rapid rehousing, but for prevention, has increased from 30% to 50%. So we have a little bit wider population of folks who can, oh, sorry, Ian.
Sorry.
That's okay. So we do have a wider population of folks that we can serve with the ESG CV dollars in prevention. Again, the other thing that we do know is that it has to go through coordinated entry systems. All ESG has always needed to be connected to coordinated entry and the COC planning and those sorts of things. But explicitly in the CARES Act, it said that prevention must run through coordinated entry systems. So I think the Pikes Peak Continuum of Care is one of the only COCs that has already built that into their system, not as a result of this funding, but we will talk about that on the next slide. So don't, have a panic attack just yet. We have a couple of solutions that should be able to help make that a little more simple. And then just a couple of other changes that we do know about. This isn't just about prevention, but it applies mostly to prevention and rapid rehousing. So there were a few mega waivers that HUD put out that we as the state did apply for. I'm not sure about entitlement communities, so folks who are getting ESG funding from entitlement communities, make sure to ask your funder about these before you just assume that they are eligible for those funds as well. So just a couple things we want to make sure that you are aware of. So the 3-month reevaluation that's required for prevention is waived for up to 2 years. So with the 6-month cadence, right? So that means that there's less, that you have to do that 3-month reevaluation. You don't have to do that for 2 years. Looking at trying to make sure that people are less exposed, quite frankly. So again, with housing stability case management, same sort of thing, that monthly meeting is not required any longer. And then the restriction of the fair market rent has changed, and there is now a rent reasonableness alternative. So I know a couple of folks, specifically around the North Front Range, are having issues with finding units that meet that FMR. So we can use rent reasonableness now, and there's not too much guidance on that one, but I'm sure that you all know. And it looks like there's a couple of questions that are popping up. Okay, give me just a minute and I will read through those. Yeah, so we will dive into the coordinated entry stuff in just a second. I believe they discussed this during their office hours usually. So Sean's question is, can we discuss any steps being taken by HUD to lessen administrative burden and program operation burdens on programs, and how DOH is navigating that with sub-grantees? I believe they discussed this at their last office hours. Yes, so part of what we are trying to do at the state is make sure that everybody has access to that admin funding, which is historically we only let the local governments or CSCs have access to that admin funding, but that's something that we're wanting to make sure of, that even our shelters and outreach providers have that. As far as what HUD is doing to lessen the administrative burden, I am not sure about that one specifically. I'm hoping.
Cassie, I can help step in if you want for that.
Yeah, absolutely. That'd be great.
Hi, everybody. Yeah, thanks. It's Kristen Toombs, so with Division of Housing as well. Hi, everybody, and thanks for joining. So I think, Sean, you might also be referring to maybe some of the waivers that have come out, and we have applied for eligibility of every waiver, so we can make sure you guys know what those waivers are. Oh, there it is. There's an example of some of them. So some of the waivers have to do, and I apologize for the noise in the background. Some of the waivers have to do with paperwork and administrative burdens. Some of them have to do with program parameters. And so we can share that, but whatever HUD has done around allowing flexibility for any of their programs, Division of Housing has applied for and received those eligibility for those waivers where it's applicable. Hopefully that helps answer part of it in addition to what Cassie said. And if I'm off, well, here's another piece of information.
Yeah, no, that's really helpful, Kristen, thank you. The paperwork requirements around documentation, Sean, yeah, so around the paperwork and documentation and those sorts of things, that, again, we're just waiting on the guides for that. I'm hoping that we'll see some ease. I think some of what we're going to talk about in the data collection stuff as well, the burden doesn't transfer onto the sub-grantees, but onto the HMIS leads. So hopefully we'll see more of that in the guides, but just keep your fingers crossed and send out positive energy, I guess, to HUD until we get those. We're hoping to see those soon, but yeah. Okay, yes, many answers are still needed, very much so. Okay, great. Any other questions? Nope, I think that's everything. Okay, great. Ian, would you mind going to the next slide, please? Okay, so here's where we're really going to dive into that coordinated entry stuff. And I think we had Ian who's going to cover this one. Yeah, so Ian, I'm going to let you take it over.
Great, thanks. Hi, everyone. Thanks for joining. So just again, based on what we know, current context without the official HUD notice, we know that all referrals for any of the ESG CV resources have to come through coordinated entry. I would say that, excuse me, what we have heard and some of the guidance that has kind of come around from our HUD TA is that that doesn't necessarily need to look exactly like how coordinated entry may operate in your community as of yesterday. And so you could do things like a COVID-19 prioritization option. So if you just have folks in motel and quarantine and isolation units, non-congregate sheltering, that can automatically prioritize those people for resources like rapid rehousing. These are things you have to discuss with your COC, and that has to be documented so that you may have a temporary coordinated entry policy, but certainly options there. On the homeless prevention side, I think that there's certainly a couple of ways you can go. You could kind of do the PRVI SPDAT, which is essentially the length of the existing VI SPDAT for those of you that are familiar with that tool. But there's also other kind of tools that you as a community could create. And so I think that some of the tools might be scoring tools, and some of them might be threshold tools. So a threshold tool would just say, have the person, the tenant who's seeking prevention assistance, answer these 10 questions. If they score a 5 or above, they get assistance. If they score a 4 or below, they don't. And those decisions could be made at the local level. Jennifer's sharing for Pikes Peak, they use the prevention SPDAT, and they have a policy in place that was implemented in April. Jennifer, maybe we could share that out, that policy language out with the other COCs and partners, just as an example. Thank you. So these are things that could be locally determined, and again, can be determined as a temporary policy during COVID, and then you have to determine when that termination date is, or it could be a permanent policy moving forward. I think the goal on the prevention side is showing that we know all of the data shows that eviction prevention is not exclusively homeless prevention unless you target people with histories of homelessness. So if you were to serve 10 people with eviction prevention, only 2 of them would be likely to end up homeless. The rest would have been able to figure it out. And so we certainly don't want people to be evicted. That's not what we're saying. But we're saying if it's truly homeless prevention, that in that threshold screener, there should be something like a history of homelessness as a priority, for example, or if your community knows that you have survivors is a particular need, histories of involvement with victim service providers, domestic violence agencies, etc. So again, all things that you should be working with your COC on figuring out what makes sense for your local community. And then I would this is kind of my thing I always mention for those who are on all the webinars. If you are serving veterans, please be referring them to veteran resource agencies. The eligibility for SSVF has expanded basically to be completely open for any veteran, as well as some of the VA programs have had additional resources. And so if we can serve those veterans through VA resources, that means we have more resources available for non-veterans. So, ask the question in your intake process, have a mechanism for referring to those agencies. If you don't know how to get in touch with those agencies, we can connect you, certainly. They do cover the whole state. So I'm going to pause there and just see if there are any kind of general questions around the coordinated entry and referral based on what we know right now.
So this is Cassie. There's nothing in the chat, Ian, but Naomi did say a simple screening tool would be great. Do you think that we could have maybe some examples of those threshold screeners or something like that we could send out?
Yep,
Okay,
I've got a collection. I can figure out either to put them on the DOH COVID website, or we can email them out to this group.
awesome.
And then I believe this is me again.
Yes, it is.
So for those of you who are not domestic violence providers, I'm going to talk to you all first. So if you've had historic ESG, regular ESG, you are the ones typically submitting the reporting. And so the difference now with ESG CV is that that is going to happen through the HMIS leads. And so they're going to be responsible, each COC's HMIS leads are going to be responsible for submitting the reporting for the different project types. So they're going to send HUD a quarterly report for all emergency shelter, for all prevention, for all street outreach, for all rapid rehousing, etc. And then they will also be sending a cumulative kind of program to date report to HUD. And so that's a change. And we've been coordinating with the 4 HMIS lead agencies to make sure that ESG CV is set up in HMIS correctly. It's really important that you treat ESG CV as a separate program than your traditional ESG if you were receiving traditional ESG. So if you have an ESG regular program set up in HMIS, you can't use that same program to track this because these are separate funds. If you are an agency that is receiving these funds as CV1 and you are also receiving CV2 in the future, which is all to be determined, those can be tracked in the same program. So they treat the CARES Act funding as a single program. So you won't have to have 3 ESG programs to track: ESG regular, CV1, and CV2. If you have all 3 of those, you'll only have 2 programs you need to track in HMIS. Our goal is to have all of that, be a burden that is taken off of your plates. And so we're working closely with the funding agencies. So they're sharing who are the recipients. What are the recipients you all, providing? Okay, this agency is receiving funding for emergency shelter. Let's make sure they have an emergency shelter grant available, program set up in HMIS. If you are a new agency or you have new end users because of the expanded use of this, so maybe you were using HMIS in the past and it was these 3 staff over here, but now because of the additional funding, you actually need 6 staff with access. We're working on creating some streamlined processes to get staff trained quickly and all across the state so that people can be using this right away. For those of you who are victim service providers, we are working to utilize Cafe, which hopefully many of you know about. It's a Salesforce-based platform as the DV comparable database. You all will need to submit your own individual reports. That's based on what we know right now, because your systems don't communicate to one another. They're all their own instance with your specific agency for the protection of survivors. And so there's not a way for us to pull aggregate projects across the state. We are working to figure out a way to track the COVID connection in HMIS. So it could be, for example, that you have in your intake a service that's just a COVID-19 service, that your staff, that's where they put the connection to COVID-19, so that we could easily pull a report and see, okay, this is the connection. Obviously, if you're using this to fund a non-congregate shelter, the very essence of someone being enrolled in a non-congregate shelter is a COVID-19 connection. So you wouldn't need that additional kind of action step of documenting that necessarily. But we're working on figuring that out. But we strongly encourage you to have a consistent place until we figure it out to document that COVID connection, so that when you're monitored, it's just really easy to pull that data out. So we know that there's going to be an expanded need for the supporting the HMIS leads, supporting you all as agencies, expanding end users across Colorado with both CV1 and CV2. We're expecting about a 50% increase in utilization of HMIS. So additional agencies, additional programs, additional end users. So, we're budgeting for that. The entitlement communities are budgeting for that. So just wanting to let you know, we've been in communication with the leads for a number of months trying to prepare for this. So if you don't know who your HMIS leads are, please reach out to us and we can help connect you. So Nan had a question and Cassie answered it there. So great. And then Denny is asking about the build out of the cafe system. So Cassie, I'm wondering if you can share about where we're at with that with the OIT.
Yeah, absolutely. So we are working with the Office of Information Technology, I believe that's what the acronym stands for, which is our the DOLA tech folks who are helping us build out Cafe. So basically, Denny, to answer that question, the system does what we need it to do right now, except for being able to pull the caper specifically in the format that it's needed to be uploaded into Sage. And so we're working with the Salesforce developers to figure out what that cost would be to just basically create a new report mechanism within Cafe. So it's not actually going to structurally change the Cafe system. It will still have all the security requirements. Anybody across the state who receives funding from the Department of Human Services for the victim services, they have to use Cafe right now and have to use that to report to CDHS. So as of now, and if there are any victim service providers on the phone that this does not apply to, please let me know sooner rather than later. There's a complete overlap. There's not an agency that we serve through ESG that doesn't also receive that funding and use Cafe. So the reason we would love to be able to have DV agencies on HMIS, but the security is just not there. And it's a completely different structural setup to keep, like Ian was saying, to keep victims safe. So we're hoping, I actually have a meeting with them later today where they're going to give us a scope of work and the timeline and all of those details. I'm hoping, knock on wood. So I should be able to have more concrete answers for folks this afternoon, theoretically. Yeah, to answer that next question, we're really hoping that it will be sooner rather than later. We've been working with them since before the pandemic started to try and get the system to be able to do this. So depending on how much work needs to be done, it might take a little bit longer, but from what I've heard kind of in a preliminary sense, it shouldn't take that long because we might add a few new fields and those sorts of things, but it really shouldn't take that long to pull it out. So then in the meantime, what do you want? So in the meantime, we will have reports for the DD providers in the same way that we've been having with the regular ESG Marine. And I'm not sure if you are a recipient of the regular ESG. Feel free to shoot me an email and we can dive into the nuances of all of that. I ideally will have the Cafe system up and running within the next few months, but that's it's completely dependent upon OIT's timeline. So again, I should know more this afternoon. Needing to retroactively. So about the needing to retroactively enter into HMIS that's been down, it really depends on the funding source or the component source. So if you're doing shelter operations and those sorts of things, we will need you to be in HMIS, but there wouldn't be any retroactive cases for you to go in. But if you're doing something like rapid rehousing, then we would need that to be through HMIS. I don't have the specifics of that. And I know Erica is our TA provider, and it looks like she's on the line. So Erica, I don't know if you have anything that you wanted to add, or if you know of anything, feel free to, I just allowed you to talk, so feel free to throw that out or shoot it in the chat. But we will get that question answered and send a very concrete answer back to folks. Obvious question, trying to figure out, does moving someone out of a higher risk population into a non-congregate shelter count as COVID connected? Dan, so it's not an obvious question. This is all very dense, so I think that's a great question. So it really, anything that you're doing as a mechanism by which to prevent the spread of COVID could be COVID related. So if you're moving somebody out of a very dense encampment because they are at high risk for COVID and you're moving them into non-congregate shelter, that would be a COVID connection because that's following CDC guidelines, it's following best practices. It depends on how you're reporting that and what funding source you're using for that. But anything that you are doing so as to prevent the spread or to help folks who are vulnerable get away from a potential outbreak or anything like that. I mean, even providing hygiene, or, you know, the ability for people to wash their hands, or, you know, providing physical barriers in your shelter. I mean, anything that like that is connected to a CDC best practice around COVID is what we've heard that's how you show that COVID connection. Naomi, I'm not quite sure what the question same CABR report but separate means. Looks like Ian is answering some of these. Thank you. Erica, yep, so Erica's gonna get some answers for us, and as soon as we get that, we will send it back. Thanks for that, Erica. Sean, let's definitely touch base about CAFE. And Erica, there's a training next week for state recipients on ESG. Yep, she's absolutely right on that. Okay. Separate from the regular ESG report. Yeah, Naomi, I'm sorry, I'm still not understanding the question, but that might be a me thing. I'm just trying to zoom through all the questions, but yeah. Okay, I think I got all the questions. If there was another question that we did not get to, please feel free to throw it at the bottom of the chat so that we can make sure that we answer it. All right. Okay. Great. I think that's everything. Ian, do you want to go to the next slide? Okay. So this is one thing that I really want to make sure that we talk about. So this language that's, again, in italics is specifically pulled from the CARES Act. So housing first, it's a requirement in the CARES Act. Provided further that funds provided under this heading, which is the CARES Act, may be used to require, may not be used to require people experiencing homelessness to receive treatment as a precondition. So we need to make sure, and we're going to have, one of the things that I'm going to talk about as part of our next steps is making sure that we're going to have more expanded TA internally in OHI to be able to go in and manage these recipients and to manage these contracts and to give you all the TA that you need and the assistance that you need and those sorts of things. Ian, thank you for making that edit. So part of what we're doing right now is actually hiring an ESG team so that we can help with some of these implementation pieces. We're going to be able to actually provide like one-on-one assistance around how to be housing focused, how to incorporate best practices, all of that sort of stuff. Being able to use this huge increase of funding that we're seeing through the ESG to create an internal kind of expertise around ESG. So keep an eye out for that. We're excited to hire folks in the next few weeks, which for folks who are normally receiving ESG, what that means is that your asset manager, your contract manager, that contact will likely change for the ESG funding. But what we're hoping to do is to be able to provide one in-house person who can help you with any homelessness contract, as opposed to kind of having to bounce around. If you get a lot of funding from us, that's probably something that you are used to, is having a lot of people that you have to talk to. So that's really one of the biggest things, specifically because of this language that talks about, you know, needing to be housing first, wanting to be housing focused, knowing that, you know, some experts are expecting to see anywhere from like a 30 to a 50% increase in homelessness because of COVID. I know we all know that the evictions are potentially starting to happen. Job loss is still a huge issue. So please do know that, you know, part of what we want to do with this fund is not only expand your capacity to respond, but expand our capacity to help you respond. So, you know, going back to Sean's question around the administrative burden on sub-grantees and those sorts of things, please let us know what we can do to help, how we can make these funds easier on you all. You know, obviously they're not our funds, so there's only a certain amount of things that we can be flexible around. But we are absolutely, our intention is to be able to be as flexible and as supportive as possible, because we do want to get these dollars out the door. We do want to see them implemented in areas where we have had, you know, gaps in our system. And we want to be able to recover from this crisis with a better homelessness response system across the state. Cool. Okay, next slide. And it looks like, Ian, you're answering most of these questions, so thank you. So are there any other questions? Yeah, okay. So yeah, so Naomi, yes, thank you. The ESG CV report is separate from the regular ESG. Ian has gotten most of these things answered. Awesome. Any other questions, any other concerns, any other things people have on their mind? Is there certain advice in communities? In communications. Oh. So yeah, so I don't know if there's like a state recommendation, Shauna, but there's lots of research that's been coming out, and we can start to send that out if you guys are interested, just from different homelessness experts, kind of more at the national level, looking at what could happen. So if you're interested in that, let us know, and I'm happy to send that research your way.
Hey, Cassie, for that part on the prevention, we're just a plug. We're going to have a webinar on the 26th, our State Homeless Task Force webinar, focusing specifically on two topics, prevention or inflow, people coming into the system, as well as cold weather sheltering, of which we don't have a ton of guidance from HUD, but we know there's some coming very soon. So we'll have certainly a more in-depth cold weather sheltering conversation for those of you shelter providers and kind of community planning folks. This will be the kind of the intro conversation to that, but we will have a deeper dive into the prevention and inflow conversation on the 26th, which is, again, linked in that document I shared very early on for upcoming webinars. I can also send you that information if you send me an email. I'll put my email in here. I think what we could do is figure out a way to kind of consolidate some of the data points and see if that's something, you know, that we could work with Kristen and you know, others to make a little bit more consistent messaging so that everyone is making the right ask around the same data.
Mm-hmm. Yeah, thanks for that, Ian. That's really helpful. Sean, so yes, I think to answer the question, DOH is open to creative ways of implementing the program as long as it, of course, fits within the guides, right? The reason that we're being a little flexible with the CV guides is because we don't have them yet. So I think, you know, CES, as long as it's documented and as long as it fits with that required model of what CES is, right? Like, so it can't just be like, oh, we're gonna have a coordinated entry system that relies on first come, first serve, right? Of course, I know that's not what you're saying. I just want to make sure that, you know, we are able to be flexible as long as these policies and procedures are aligned with best practices and are aligned with the normal way that these things work. The COVID funds, again, we haven't heard that they're going to, we haven't heard any real concrete things about them except for what we've already mentioned in this webinar. But we've been told that they're not going to be more restrictive than the normal fund. So there might be some flexibilities there, but again, we don't know what that looks like. So yeah, it would be useful if everyone cited the same information. Yeah, absolutely, Shauna. And I think that to Ian's point, what we can do is pull those research points that we've seen. And as part of the follow-up to this webinar, I've got kind of a list of things that we're going to be sending out that folks have asked for. So I think part of what we can do is provide some of those research points so that you all can take it to local funders or whomever and use that to advocate for yourself. Ian, thank you for putting that in there. Yes, if you could just quote, Sean, don't get too ridiculous in your policies and procedures. Awesome. Kristen just shared a link on the projection. That's great. Okay. Any other questions, any other concerns that folks are having? Okay. All right, so let's go, Ian, if you wouldn't mind going to the next slide, please. Right, and Ian can unmute if it's a complex question, for sure. Let's definitely do that. Okay, so just some next steps. Yeah, so like I mentioned, we're hiring an ESG team, so there's gonna be 2 full-time people who are solely dedicated to ESG, plus a few other folks on our team who are part-time working on ESG, and that's, again, to get this huge amount of dollars out the door, but also to make sure that we're really strategically thinking about how to use these funds and making sure that we are not, that we're not the roadblock, so to speak, that we're flexible and helpful to you all who are actually doing the work on the ground. So yeah, just a couple of things to know about. So yes, the winter sheltering during COVID-19, that's a webinar that's coming up on the 26th. We are also going to be looking at doing other sorts of training over the next few months, hopefully in coordination with the entitlement communities, just so that we can have one message across the state, and specifically folks in the metro areas aren't having to track things different ways based on different funding sources or have different priorities. So we're working with them to really look at things like data quality and reports, and if we do we share language in the NOFAs or in the contracts. We're really starting to dig into with them now on that. The other few other things that we have talked about wanting to do trainings around are really helping how to be housing-focused shelter and outreach programs, so that we're getting people out of the shelters more quickly and not necessarily just putting them into non-congregate sheltering, which is great, but really ideally we could get them more quickly connected into housing, and that's the best way to get them out of the COVID pandemic is to get them into housing. And then really looking at, what do our rapid rehousing and prevention models look like in COVID-19, right? We know things like progressive engagement and working with folks on the front end of rapid rehousing or national best practices, and in COVID-19 that might need to change, right? So we're really digging into that. If there are questions or webinars or trainings or those sorts of things that you all would like to see us put on, please feel free to let us know. Always just know that you can always reach out, and we will either help answer the question or connect you to the folks who can. And likely your question is a question that many other people have, and we would love to just provide any resources or technical assistance around that we can. So Nan just threw a question in. If we see an increase in homelessness, it will likely be first timers. How does this fit the prevention requirement to support people with a history of homelessness? So yep, Ian, that's great. So talking about diversion, which we'll cover on the inflow webinar, which is what I've got here as the winter shelter during COVID webinar, the same thing. The other piece, Nan, just so that you know, is it's not a requirement that the prevention has to support people with a history of homelessness, but what we do see is that folks with a history of homelessness, when presenting as needing prevention, statistically will actually end up homeless more than folks who don't have a history of homelessness. So really being critical about looking at, who but for this funding would end up homeless. And of course, like Ian said, he's really going to dive into that on the webinar on the 26th. There's lots of program models and lots of ways to be flexible around that. So make sure that you join that webinar. Okay, so contracts. Yes, contract forms will be out in the next few weeks. Again, it will look very similar to your regular ESG contract. There will just be some changed language around prevention, reporting, pre-agreement costs, those sorts of things. And the reporting forms will look very similar, again, just with the nuances around how this is connecting to COVID and those sorts of things. There won't be a match reporting form that's coming. So just a friendly reminder that there is not a match required for these funds, which is exciting. Again, the next external stakeholder meeting is August 31st, 2020. I think that link is in the chat, but I'm going to send a follow-up to this email for everybody who was on and give you all the links to the webinars in one spot so that you can easily access those. So don't feel like you need to scroll back up and try and find it. And again, just a friendly reminder, we are still waiting on the official HUD CD program guidelines. So take everything that we have said today with a grain of salt. This is what we are working on. This is the best knowledge that we have today, and it might change, but we will definitely let you know if it does. who are not. Yeah, I wonder if you can connect the new recipients who are not the usual ESGs. Yep, absolutely, Dan. And anybody else on the call who's not a regular ESG recipient, if you have specific questions around what is normally expected in ESG, anything that might sound confusing, or any acronyms that we use today that don't make sense, please feel free to ask and let us know what those questions are. Maybe we do a first time. Yeah, and Ian's suggestion is that maybe we have a first time recipient ESG webinar. I think that's a great idea. So, yep. Cool. Awesome. Ian, next slide. I think this is the last one. Yep, great. So there's my contact information. Anything that you guys, any questions that come up, you know, if you're like me, you wake up in the middle of the night with burning ESG questions, so please feel free to call or email, and we can get those answered. I think a little earlier, somebody put all of our contact information in the, yes, Ian did, thank you. So that's all of the ESG team that we have right now at the state, so feel free to email any of us if you have any questions. Again, this webinar will be recorded, will be put online. You will get a follow-up email from us, and you'll see contracts and documents coming in the next few weeks, hopefully sooner rather than later. That's all we have. So we do have another 30 minutes. Yeah, just to reiterate Kristen's comment there, you guys are all the ones that are actually doing this work, boots on the ground, and I just want to really make sure I'm clear if there's anything that we can be doing to help you all do that important work easier, better, more effectively, please let us know. We're just here to support you all and get you the resources that you need. And so however we can do that, however we need to be better partners or be working differently or whatever, just please let us know, because this is a very hectic time, and we so appreciate all that you are doing. And we will stay on a couple more minutes. So maybe Nan, if you have first-time recipient questions or other folks who have questions, I think Ian said he can unmute people. So yeah, otherwise I will give you 30 minutes back in your day, but for folks who do still have questions, please feel free to stay on and let us know what they are. But otherwise, I will talk with you all soon. Thanks for joining us today, guys. Nan, I am looking to unmute you. I just gotta find your name.
Great, thanks, Cassie. I am following most of what you're saying, but since I don't understand the mechanisms of any of it, and I don't have a contract, I'm like, what? How?
Sure.
How do we play in this arena? So, you know, we haven't gotten an HMIS license, I don't think, yet. We're contracting with West Mountain to do that for us, I believe. That was part of our, our proposal. And so, and we have, I'm all good with, mostly with the coordinated entry, but we haven't because we have a BFC, right? But all of the cases that we had in our winter shelter, most of them have been BI SPDATed, but it wasn't part of our program then. So I'm just curious about what and of course you're waiting for HUD guidance. So maybe I just have to hold on.
No.
Just trying to figure out, and I know Kelly's going to listen in. I don't even know if this is the right webinar for her, our finance director, because I don't really have a sense of how we're going to draw down the money.
Okay, yeah. So that's, and anybody who's listening who's a first-time recipient, that's actually a really great question because it is kind of nuanced. So what happens is it's a reimbursement model. So, well, actually, okay, I'm going to step back. So for your HMIS stuff, Definitely let us know if if you're not able to get those licenses, because like I was saying, we're working really closely with all of the HMIS leads who are the entities that provide those licenses. So we can help connect you guys to the right people if that's a challenge. On the question about do things need to go back to March 27th, I have a sense of what the answer is, but I don't want to say it just because I'm not 100% sure. You're funded for street outreach and shelter operations, correct?
And data.
And data, right, okay. So for street outreach, your HMIS piece will look different between street outreach and shelter operations, right? Like there's nowhere in HMIS to say, we paid this utility bill, or we did this. We still want your shelter to be using HMIS for case notes and, entry exit data, demographic data, those sorts of things. But we're not going to pull like a number of people served from your operations pieces.
Okay.
But for your street outreach piece, because you're meeting with people one-on-one, that's
Right.
a different situation, right? But I will look for the specific guidance on if you have to go back and do that. That might come out with the guides though, so take that with a grain of salt. So that was the first one. So the coordinated entry piece, again, it looks a little bit different for the shelter and outreach components than it does for the prevention and rapid rehousing components. So for shelter and outreach, what you said that you're doing of connecting people to the coordinated entry system while they're in shelter, that's great. There are some communities who use coordinated entry to get people into shelter, but you really only see that in areas where there's just like Los Angeles, right, where there's like this huge unmet need of literal homelessness. So as long as you all are connecting the people that you're seeing in your shelter, in your street outreach programs to your coordinated entry system, that's great. On the prevention and rapid rehousing side, however, that's where when people get connected to those rental assistance resources, that needs to come through coordinated entry. And that will look different depending on the continuum of care that you're in. So that it is a little bit different there too, but what you're doing for your shelter and coordinated entry sounds great. And then the mechanism of the way that the funds are drawn down. So yes, like I was saying, that's a reimbursement model. So what you'll do is you will get the cost, you will give us the documentation of, we spent, what $100 or whatever on this utility bill. You'll send us that bill. For you guys, you stood up the shelter because of COVID and because of the emergency response around COVID. And so what you'll say is, the reason that we set up the shelter was to help people with COVID. Here's our bill that required that we had to have to set up the shelter. And we will, when we send you the contract, you'll also get a pay request form, and you can meet your contract manager, and they'll be able to tell you, like, here's exactly what we need. Here's when we need it. All of that will be in the contract. So just make sure that your team really reads through that Exhibit B of the contract. And then, of course, if you have any questions or anything as you're going through, I mean, that's what myself and our contract managers are there to help navigate. So, if you have a question about the pay request, or, do I need to include this sort of documentation or not, or anything like that, I mean, we would rather work through that first one more intently so that you guys can figure out what makes sense and know how to track and all of that. So just let us know what questions you have when you actually see the documents, and we'll walk through it with you.
So thank you, Cassie. A couple of things. When you talk about the HMIS lead, our current lead is the COC. We applied outside of the COC, right?
Yep.
Kind of with, but not with, because they weren't with us. So we're trying to set up a new HMIS lead for, or a parallel. Is that what, are we talking about the same thing, or do I need to not contract with West Mountain and I need to contract with Catholic Charities since they're the current lead?
Hey, Cassie,
so
can I try to?
Yep, go ahead.
Okay, hi Nan, it's Ian. So, so the folks doing the data entry, that can be anyone. That when we talk about an HMIS lead, that's like a very specific HUD term. that suggests the people who are operating the actual HMIS software, which is different than the folks who are entering in the data. So so you would still be going through the coalition, and so Denny Wetmore, Tyler Buck, Sean Hayes can get you connected. So, you know, those are the folks to still be working with to make sure that the agency, I forget the name of the Westbrook, maybe
West Mountain.
West Mountain,
Yeah.
that they have access to HMIS
Okay.
and are set up correctly as a program to enter the data. So that's what we mean when we say HMIS lead. It's like this very internal language. So yeah, it would be your partners at the coalition balance of state, Sean, Denny, Tyler can get that going. So, and it looks like Sean just parked some info in there, but that's who to go to just get the ball rolling on, you know, end user licenses so that West Mountain can start entering data.
Okay.
Ian, I'm always really happy when what I was going to say matches what you said. That
Awesome.
helps me to know. I'm learning slowly. I appreciate that.
Right. Right. So we'll just need the policies and procedures, right? And
Yep.
And then Cassie, I saw you said that you would talk to me offline about the prevention dollars, which I just keep hoping I'll have.
Yeah.
If it's coming through Catholic Charities, and Marion doesn't know about it yet either. Where it's happening and how do we tap into it so we don't get lost in the big system?
Yeah, no, that's a good question. We are actually having a meeting this afternoon with the folks at the Balance of State to let them know what agencies asked for money from us through the needs assessment, and help figure out how to make that connection. So what they'll do, and I don't know what the actual official process will be, but they'll put out some sort of notice or guidance or whatever. And I believe they actually work with, we've had this conversation, they work with Catholic Charities through a different funding source, so that relationship is already established. So it takes some time to get through the levels of bureaucracy, quite frankly, but you haven't missed out on that opportunity. And again, like I said earlier, I know I do owe you an email. I've been out for a couple of days and I just hadn't gotten to yours yet, but I will get back to you this afternoon.
Okay, and I see Tyler wants to connect, and so happy to do that, Tyler. Just email me. And I appreciate it. I think I am used to a little faster. Believe it or not, even with CDHS, things tend to move faster. So I apologize. I'm just trying to learn the system, and I appreciate how complicated it is with federal funding. And so anyway, I'm just anxious to reimbursement because I'm getting pressure from commissioners.
Totally. And however we can help provide, that explanation of why it's taking so long. I mean, we're still waiting on those guides, and there's still some things that are coming out that we're still waiting on too. And I know that our pressure just adds pressure the further down it goes. So please feel free to let us know how we can help.
Yeah, thanks everybody for your time. Did anyone else stay on, or am I just the neediest person on the planet?
No. You got 20 other people on. Like I said, I'm sure your questions are other questions.
Awesome. I'd like to hear if other people have questions. What are your
And again, I can unmute anybody who needs to just either raise your little Zoom hand or put a note in the chat.
And I know this is Kristen Toombs, not to put her on the spot, but I do know we have our wonderful HUD technical assistance consultant who's been kind enough to join us. Erica, I don't know if after listening to all of this, if you have any comments for us or for those who are still on the call. Not to put you on the spot, and you don't have to. Just curious your thoughts since you've been digging into this with us. And I don't know if we need to unmute Erica.
I'm on mute.
I can't figure out how to do it.
Good.
She said she's
Yeah,
on, but knows everyone is waiting on the HUD notice. So
Thanks, Erica.
and yeah, just for folks who are still on the phone, if you guys do have questions, Erica is really helpful in getting us connected to the right folks, the right sources of information. So any other questions that do come up that are in the lead like that, definitely send them our way. And if we can't answer them, we can get them up to Erica, who can help us navigate for sure.
all right, seeing no more questions, I'm gonna end the recording